The source checks in now with Derek McNally from Niagara Health. Derek, resumption of elective surgeries and some previously canceled surgeries. How is that going? What kind of numbers are you seeing?
Hi, good morning, Mike. We, as you know, started last week with the resumption of surgery and procedural care. So between May 25th and June 5th, we saw 1,000 patients for radiation treatments. We saw 700 patients for chemotherapy treatments. Nearly 250 patients for skin cancer and about 560 patients for urology procedures. And also from a diagnostic imaging perspective, over 4,100 x-rays were done in that same time, about 2,000 CT scans, and over 1,200 ultrasounds were done at those times. We're slowly ramping up our surgical procedures, as you know. We started last week with mostly day surgery procedures, so procedures that patients wouldn't require an inpatient bed post-operatively. So we did cataract surgeries and some other day surgical procedures. And so this week, we've increased the numbers of cases and we're bringing patients in who will require an inpatient bed. But obviously, as we've talked about before, Mike, continuing to monitor very closely our inpatient capacity, the COVID incidence in the region, our drug supply, our PPE supply, etc.
Those numbers, how would they compare on an average week pre-COVID?
Anywhere between 25 and 35% of the volume that we would normally be at. We've continued to run the Walker Family Cancer Centre, so radiation therapy, systemic therapy, or what you might call chemotherapy. We've been running full tilt in the cancer centre so that we're not stopping life-saving treatments for patients with cancer. So that centre has been going full on since we started the COVID shutdown.
When it comes to staff that might have been redeployed into other areas of the health system, are they now able to get back to what maybe their normal duties would be under this revised and ramped up number of procedures?
Sure. Great question, Mike. So that's part of our recovery planning state, and staffing is obviously critical for us being able to get back to what the normal state is. So what we are actually doing is part of the work that we're doing for ramping up, we're looking at all those areas who are increasing their volumes, looking at the staff that they actually redeployed and pulling those staff back. But of course, we still have to make sure that we have enough folks at the front doors screening patients, runners taking patients, making sure that access to our facilities is open, but it's inclusive of the demands and the directives from the province.
Currently, no volunteers either in the hospitals. Is that correct?
That's correct. Currently, no volunteers. That's another group as part of our recovery planning. They're actually looking into what that actually might look like from our volunteers' perspective, but none right now.
Derek, there's been a lot of talk about a second wave of COVID-19 almost being inevitable. So what kind of preparations does the health system make at this point in time to make sure that as you're ramping things up, you're able to deal with a potential second wave?
We've been directed by the province as well as ourselves really to say, okay, if this wave comes, and they say, I have no evidence, but they say, Mike, that it may be even more difficult as we get into the fall if the second wave comes, because we also have flu, we have RSV, we have all those other illnesses that typically come in the fall. So we have a group as part of our recovery planning who's actually putting together that textbook, if you will, of our ramp down procedures. We did it all, and everybody sort of stepped up to the plate back in March when we had to do it. We're pulling all that together so that we have one ramp down document with checklists, because what we're hearing is if this actually starts to go again, we will be given 48 hours notice to close the place down completely again. So the team is working on it. They're almost there. We're confident that we will have a plan, and for sure, if in fact we get the directive, then we'll be good to go, Mike.
It's fascinating. As we ramp things up, we still have to be prepared for a about face, I guess. Thanks again for your time, Derek. It's always great to hear your expertise about our health system. Thanks again.
Thanks, Mike. Always a pleasure. Have a great day.